Most men have noticed this. Maybe in the shower, maybe getting dressed on a cold morning, maybe at the beach on a winter day. The body responds to temperature. It contracts. It pulls inward. Everything tightens, shrinks, retreats. And most men think this is just normal biology. Cold equals smaller, heat equals relaxed, simple physics. But what if I told you that the speed of that response, the degree of that change, and how quickly your body reverses it when you warm up again? What if all of that is quietly telling you something far more important than you realise? I'm Dr. Emily Carter. I've been a practicing urologist for over 15 years, and in that time, I've observed thousands of men who assume their body is functioning normally because the response still happens. But they don't notice that it's slowing down. They don't see that the degree of change isn't what it used to be. And they certainly don't understand what that change actually reveals about their vascular system, their circulation, and their overall health. Because this isn't just about temperature sensitivity. It's about how efficiently your blood vessels can respond to signals, how quickly your smooth muscle can contract and release, how well your nervous system communicates with the tissues that depend on rapid, precise blood flow. And when that system starts to slow, when the body takes longer to respond, or doesn't respond as dramatically as it once did, that's not aging. That's adaptation. Your body compensating for something deeper. Something most men don't connect to this simple, everyday observation. So before you dismiss this as trivial, stay with me. Because what I'm about to walk you through might completely change the way you understand what your body has been quietly showing you for years. Let's start with what actually happens when your body encounters cold. The moment your skin registers a drop in temperature, a very specific sequence begins. Your nervous system sends signals through pathways that have been refined over millions of years of evolution. These signals travel to the muscles embedded in your skin and the structures below. In the scrotum, there's a thin layer of smooth muscle called the dartos. When cold hits, this muscle contracts. It pulls the skin tight, draws everything upward, reduces surface area. The goal is heat conservation. At the same time, another mechanism kicks in. The cremasteric reflex. This pulls the testicles themselves closer to the body, protecting them from prolonged exposure to temperature extremes that could affect sperm production. And then there's the penis itself. The smooth muscle in the penile tissue responds to cold by contracting. Blood vessels narrow, blood flow reduces, the tissue becomes smaller, denser, more compact. This is protective, functional, designed to preserve core temperature and protect reproductive capability. But here's what most men don't realise. This entire process depends on something called vascular reactivity, the ability of your blood vessels to rapidly constrict and then, just as rapidly, dilate again when conditions change. And that reactivity is controlled by a molecule you may have heard of before: nitric oxide. Nitric oxide is the primary signal your blood vessels use to relax and open. When it's produced efficiently, your vessels respond quickly. They expand when they need to. They contract when they should. The system stays flexible, responsive, alive. But after the age of 50, nitric oxide production starts to decline. Not overnight, not dramatically, but steadily. Some studies suggest the decline can be as much as 10% per decade. By the time a man reaches 60, his baseline nitric oxide levels may be half of what they were in his 30s. And when nitric oxide drops, vascular reactivity slows. The blood vessels still respond to temperature. They still contract when it's cold, but they do it more slowly, less completely. And when warmth returns, the reversal takes longer. This is where the observation becomes significant. A man in his 30s steps into a cold shower. Within seconds, the response is complete, dramatic, obvious. A man in his 60s steps into the same shower. The response happens, but it's not as fast, not as pronounced. And when he steps out and wraps himself in a towel, the return to baseline takes minutes instead of moments. He may not consciously notice the difference. After all, the response is still there. But his body knows. And if he were paying close attention over the course of years, he might start to see a pattern, a delay, a muting of what used to be an almost instantaneous shift. This isn't about size. It's not about adequacy or function in the traditional sense. It's about the quiet degradation of a system that depends on speed, precision, and responsiveness to work properly. Now let me tell you something that might surprise you. The difference between summer and winter becomes more pronounced as men age. In your 20s and 30s, your body handles seasonal temperature variation without much difficulty. Whether it's July or January, the vascular response stays relatively consistent. Your blood vessels adapt to ambient temperature changes smoothly. But as nitric oxide production declines, seasonal variation starts to show up differently. Men in their 50s and 60s often notice that winter feels harder on their body, not just in terms of comfort, but in terms of function. Morning readiness may decline during colder months, energy levels may dip, recovery from physical activity takes longer. They attribute this to the cold itself, to shorter days, to less sunlight. But what's actually happening is that their baseline vascular reactivity has already declined, and cold weather is simply exposing that decline more clearly. Think of it this way. When your circulatory system is operating at full capacity, temperature is a minor variable. Your body compensates easily. You barely notice the difference between seasons. But when your system is already running on reduced efficiency, every additional stressor becomes more noticeable. Cold weather doesn't just make you feel colder, it makes your blood vessels work harder to maintain the same level of function they use to achieve effortlessly. And if you're already starting from a compromised baseline, that extra effort shows up as symptoms. This is why some men notice that their performance varies by season. That intimacy feels different in winter than in summer. That energy levels shift with the weather. They're not imagining it. Their vascular system is responding to environmental stress with less flexibility than it once had. Now, let's talk about what happens on the other end of the temperature spectrum. Most men focus on cold response because it's more dramatic, more obvious, but heat response is just as revealing. When you step into a hot shower, your blood vessels are supposed to dilate, open up, increase blood flow to the skin to release excess heat. In a young, healthy vascular system, this happens rapidly. You feel the warmth spread through your body, your skin flushes, blood flow increases to your extremities. But as nitric oxide production declines, heat-induced dilation also slows. The vessels still open, but they do it less efficiently. The degree of dilation is reduced, and when you step out of the heat, the return to baseline takes longer. This is why some men notice that hot showers feel different as they age. Not just in terms of comfort, but in terms of how their body responds afterward. They may feel lightheaded, fatigued, slower to recover their normal state. This isn't weakness, it's not deconditioning, it's vascular reactivity operating at reduced capacity. The same system that struggles to respond quickly to cold is also struggling to respond efficiently to heat. And this bi-directional pattern, this slowing on both ends of the temperature spectrum, is one of the clearest indicators that the underlying vascular system is losing its edge. Here's something else I've observed in clinical practice. The men who maintain the sharpest temperature response tend to be the same men who maintain other markers of vascular health. They wake up with morning function more consistently. Their energy levels stay stable throughout the day. Their recovery after exercise is faster. Their hands and feet stay warm even in cool environments. These aren't separate traits, they're all expressions of the same underlying system. Efficient nitric oxide production, responsive blood vessels, a nervous system that communicates quickly and precisely with vascular smooth muscle. When that system is healthy, everything flows. Temperature response is immediate. Arousal happens quickly. Energy is consistent. Recovery is smooth. But when that system starts to decline, all of those processes slow down together. And the temperature response is often the first place men notice because it's the most observable. You don't need a blood test to see it. You don't need a doctor's appointment. You just need to pay attention to what happens when you step into a cold shower or walk outside on a winter morning. If the response is slower than you remember, if the degree of change feels muted, if the recovery takes longer than it used to, that's information. Your body is showing you, in real time, what's happening to your vascular system. Now, I want to address something that many men experience but rarely talk about: the normalization trap. This is the process by which small, gradual changes become accepted as just how things are now. A man notices that his body responds to cold a little more slowly than it used to. He thinks, well, I'm getting older. Then he notices that warming back up takes a bit longer. He thinks, that's normal at my age. Then he notices that his morning function isn't as consistent. He thinks, everyone deals with this eventually. Each individual change feels minor, acceptable, within the range of normal aging. But when you step back and look at the pattern, what you're actually seeing is a system in gradual decline. The problem with normalization is that it prevents you from recognizing trends until they've already progressed significantly. By the time a man realizes that his circulation has genuinely changed, that his vascular reactivity has slowed to the point where it's affecting multiple aspects of his life, it's often years past the point where his body first started signaling the shift. The temperature response was one of the earliest signals. But because it seemed trivial, because it was easy to rationalize, it got normalized. And once you normalize one signal, it becomes easier to normalize the next one, and the next one. Until eventually, the accumulation of small changes becomes a significant functional decline that feels like it happened suddenly. But it didn't happen suddenly. It happened gradually, over years, while the early signals were being dismissed as normal aging. Let me give you a comparison that might make this clearer. Imagine two men, both in their mid-50s. The first man notices that his temperature response has slowed. He pays attention. He also notices that his hands are colder than they used to be, that his energy dips earlier in the day, that his morning function is less consistent. He doesn't panic. But he recognizes these as connected patterns. He talks to his doctor. He adjusts his lifestyle. He monitors the trend. 5 years later, his vascular health has stabilized. The decline has slowed. His circulation, while not what it was in his 30s, remains functional and responsive. The second man notices the same temperature response change. He dismisses it. "I'm just getting older." He notices the cold hands. "Poor circulation runs in my family." He notices the energy dip. "I'm not sleeping well." He notices the morning function change. It's probably stress. He treats each symptom as isolated, unrelated, not worth mentioning. 5 years later, his vascular decline has progressed. What started as subtle changes are now significant limitations. His circulation is noticeably impaired. His energy is chronically low. His function has declined to the point where it's affecting his quality of life. Both men experienced the same early signals, but one man listened, the other normalized, and that difference, over time, compounds. This is why I'm telling you this, not to create anxiety, not to make you obsess over every small change, but to help you recognize that your body speaks in patterns, and when multiple circulation-dependent processes start to slow at the same time, that's not random. That's a system telling you something. The temperature response is one of the clearest, most accessible indicators of vascular health you have. It doesn't require a lab test. It doesn't require expensive imaging. It just requires you to pay attention. And if you notice that your response is slower, that the degree of change is less dramatic, that recovery takes longer, don't normalize it. Treat it as information. Ask yourself, what else am I noticing? Are there other signs that my circulation might be changing? Because if there are, you're not dealing with isolated issues. You're observing a trend. And trends are what matter. Here's one more thing I want you to understand. The decline in vascular reactivity isn't inevitable in the sense that it can't be influenced. Your body is not on a fixed trajectory. The rate at which nitric oxide production declines, the speed at which vascular reactivity slows, these are influenced by dozens of factors. How much you move, how well you sleep, how you manage stress, what you eat, whether you smoke, whether you have untreated high blood pressure or elevated blood sugar. All of these variables feed into the same system, and when that system is under chronic stress, when it's deprived of the conditions it needs to maintain itself, the decline accelerates. But when the system is supported, when the right conditions are present, the decline can slow, sometimes significantly. This is why early awareness matters. Because the earlier you recognize that your vascular system is changing, the more time you have to create conditions that support it rather than degrade it. The man who notices slower temperature response at 52 and takes it seriously has a decade or more to influence the trajectory. The man who ignores it until 65 has far less flexibility. The window doesn't stay open forever. So let me bring this full circle. The next time you experience a temperature change, whether it's stepping into a cold shower, walking outside on a winter morning, or feeling the contrast between air conditioning and summer heat, notice what happens. How fast does your body respond? How complete does the change feel? How quickly do you return to baseline when the temperature normalizes? If the answer is, not as fast as I remember, you're not imagining it. If the change feels less dramatic than it used to, that's real. If recovery takes longer, that's a signal. Your body is showing you, in the clearest way it can, what's happening to your vascular system. The question is, are you willing to pay attention? Because most men aren't. Most men dismiss it, normalize it, assume it's just part of getting older. And maybe it is. But that doesn't mean it's inevitable. It doesn't mean it can't be influenced, and it doesn't mean the early signals aren't worth recognizing. Your body is always communicating. Temperature response is one of the languages it uses, and if you learn to listen, you might be surprised by how much your body has been trying to tell you. I'm Dr. Emily Carter, and if there's one thing I've learned in 15 years of treating men, it's this. The body always tells you what's happening. You just have to be willing to listen, and the men who listen early are the ones who still have options when it matters most.